So when it comes to fertility and freezing, a lot of focus is usually on the women. But how about the men? Don't you think that freezing the sperms can actually save and then secure fatherhood for the future? Today we'll be talking about sperm freezing. And hi, Dr. Ken. It's good to have you again. So we're talking about sperm freezing. Can you just help us shed light into this possibility?
Okay, so I like to look at sperm freezing because of the future, the feared future. Before talking about the regular things that we have now, okay? You see, the sperm has been going through a lot of difficult times. Yes, because it's life.
It's life, exactly.
Because we see that the count keeps reducing, and in the world of science or reproductive medicine, we keep looking for new normal. We came from 160 million per mil to 66 million per mil normal to 20 million per mil normal. Now 50 million per mil normal. Then I'm sure very soon we're going to get to 10 million meals to be considered as normal, so long as it's able to make a woman pregnant. So but the issue is that what is considered normal keeps changing. But more scientifically, the sperms are undergoing a lot of alterations, a lot of damages, and the numbers, count, qualities, and even the genetic makeup of sperms are getting really, really damaged.
This is
so much more that it's projected that at the rate that it's damaging, we could get to a future where the male race stands the risk of extinction.
This is a scary projection.
Oh, yes, it is. And this projection was made a year ago, 2 years ago, after a huge study from the University of, from Kent University in London. Okay, so this is a real life situation. I'm not just giving a hypothetical situation. And from our observation, we hardly see normal sperms when we come to analyze. On a daily basis, we review at least in my table up to 12 and 15 to 20 sperms. And when we see normal sperms, we celebrate. Agreed, most people that come to our facilities come for fertility work issues and all of that. So, all right, this may not be a representative of what happens in the population, but it's a subsection of the population, So sperms are actually going through a lot. And when they are deteriorating that way, chances are that they will keep deteriorating because the lifestyle is not getting better. What's making them get deteriorated is not taken out of the environment. If instead we're adding more and more things to the environment.
I think we should look at these things. What do you think is causing this deterioration in sperm cells? Let's just talk a little about it, just so that
the lifestyle.
Okay.
The stressful lifestyle, the diet, and the charged environment that we live in. And when I mean charged environment, I mean the electromagnetic environment that we live in. There are practically waves everywhere we live. The phone have their waves, the gadgets have their waves, telecommunication have a wave, aeroplanes have their waves. So there are waves everywhere, and all of these have negative impact on the sperms. Then stress, has a lot more impact on the sperm. Oxidative stress in the body, or the oxidative radical. So this all cause deterioration to sperms, okay? To the point that we're looking at sperms getting very, very bad. And then if you go deep to the chromosomes, the Y chromosome, for instance, has a lot of characters that have been deleted on it. And this is increasing. So this is going to genetic level right now.
Yeah.
And so much more that it becomes even more difficult to have male babies.
Because of the decreasing level of the Y chromosome.
Because when the characteristics, the genetic characteristics on the Y chromosome keeps getting deleted or getting attrition, it makes the male gender unstable genetically, so that getting pregnant with the male with male becomes a little difficult. Aborting the male babies becomes higher because nature aborts abnormalities.
Okay.
So these are all the things that are happening in reality to the sperms right now. So we have to make moves on how to preserve the sperms just for the future. Okay, so and one of those moves is
sperm
preservation, sperm freezing. Sperm freezing. Sperms that are normal today may not be normal tomorrow. You see a man coming to the clinic, say, "Oh, I have 4 kids," and so he thinks he's normal. And just take a look at the sperm and you see that you were lucky you had 4 kids. So, if you had waited till this point, you may not be able to have them. You may not have them. So a lot of things happen. So guys may also be advised to freeze sperms. And the recent findings is that when men hit 35 and are getting towards 40, the quality and count and morphology of sperms declines. And so just as we say women at 40 are also a watershed age, men also at 35 going to 40 is also a watershed age. The same thing that happens with the quality of eggs happens to the quality of sperm. Just that the count of sperm still retains for a very long time while men are aging.
So there's a high sperm count, but the quality has declined.
Qualities will decline. And when the qualities are declining, you have high rate of miscarriages, abnormal babies, like autism, happens with abnormality as men are getting older and are getting babies, and other social abnormalities in the societies happening with babies delivered by that are being conceived by sperms of older men. So you see, if sperms were frozen and are used, all of these may be reduced. But then this is just the future we're looking at. But if you come down to now, why men would have to freeze sperms. So it's now propounded that if a man has up to 35 years and is not yet pregnant, has wife or has partners with kids or has fathered a baby and the sperms are low, he should freeze those sperms, even when he is not ready to have kids, so long as he intends to have kids in the future. Otherwise, you have to battle with sperm donation in the future.
And a lot of men would not want to consider that.
Oh, wow. That's a story you don't want to start on this platform. Because you see, I respect women. Seriously, because you could see up to 4 women a day and you advise them on egg donation, they accept. But make a man accept a sperm donation, it's like going through the eye of a needle.
Wow.
I can't tell you the number of calls that I have for men without even sperms telling me they can't take sperm donation. I can. Do you know what it means to have sperm donation? I said, what does it mean to have egg donation? So women go through a lot, actually. But then, sperm should be frozen. Okay, sperm should be frozen. So there are a lot of reasons why sperm should be frozen. When there are abnormal sperms yet, sperm abnormality, and then the man is not having kids yet, he should consider freezing the sperms, because chances are that they will keep deteriorating.
Interesting.
Yes. So the world is so civilized today that a lot of men stay far away from their female partners. And then the chances of having to travel may just be very slim. And then their partners may be undergoing fertility treatment elsewhere. So they could freeze their sperms in the region where their female partner is undergoing the treatment and stay. If they can't come to give moral, emotional, and physical support for the kind of jobs that they do, frozen sperms can just be used. Military men, for instance, going on special assignment, or military men or those in the armed forces could be away from their female partners
for a long period
for years. And then no pregnancies. So they could freeze their sperms too if they have special jobs like that. And then their female partners could make attempts at getting pregnant with them.
So how long do you think these sperms that are frozen can last? Because I'm sure that's a concern.
Yes, before I finish, a common reason we see in the reproductive, in IVF units, for instance, is the fact that some men have performance anxieties because on the day of oocyte retrieval or egg collection, you make demands on sperms. So men need to bring fresh sperms. So you could use the sperm to fertilize their partner's eggs. And then for some men, performance anxiety becomes a problem and you can't do anything to make them produce the sperm. Even if you use vibrators.
Wow.
To cause them to get in the mood to produce sperm. Sometimes it's so difficult. And so you see a man with sperms but unable to produce sperm on the day you need the sperms. With all the maneuvers that you need to do, sometimes it becomes difficult. Even if they have to meet with their partners. So when you make sperm production becomes like a task, it becomes difficult for the man, for some men. So if a man has that frenzy, or there is a premonition that on the day it's required, he may not be able to produce. So he could produce ahead of time, and then it could be frozen. So these are a lot of ways.
Reasons why.
So if a man is going for treatment of a cancer condition, for instance, he will also consider to freeze his sperms. So that the treatment doesn't wipe out the sperms. So these are reasons why sperms could be frozen. Could be frozen. The aim is to achieve pregnancies with them and all of that. Then how long do you ask that sperm could be frozen? It could be frozen to any length.
Indefinitely. That's interesting. Yes. And the viability of the sperms does not decline?
No, the viabilities may decline depending on the quality of the sperms before they are frozen.
Okay.
Usually when you freeze sperms for a very long time and you thaw the sperms, you may not get the exact quantity or the number you froze, depending on the health of the sperms. But you get sperm enough to do the treatment. Yeah. Okay. Sometimes you have very good sperms. All depends on the quality of sperms. If they are very good before freezing, you are sure you get good quality of sperms. But when they are in a very poor state before freezing, then of course you battle with whatever you get. So that's it. But you can freeze them to any length. The outcome depends on the quality before freezing.
Okay, so in producing babies, a lot of persons have this misconception that you cannot get healthy babies from frozen sperms. How true is that?
No, that's not true. That's not true. If the sperms are healthy when frozen, if you thaw the sperms, they're still going to be healthy. And you could have healthy babies from frozen sperms. If the babies are not healthy, there's just a lot of reasons behind it. It may be that the sperms have genetic abnormalities.
Okay.
I know these genetic abnormalities you do not see. We don't see them. Mm-hmm. And the sperms represent the DNA of the man too. So abnormalities could come from all kinds of for all kinds of reasons. If the man has if it's an old man's sperms, for instance, and they have an autistic baby, it's not because it's frozen, it's because of the age of the man. Because the sperm has a DNA of the man, and the DNA is the representative of the life and characteristics of a man, and diseases can be transferred easily. It's just like a baby has a Down syndrome. It's not because we freeze eggs. It's because of the age
of the man as
of the woman, for instance, when you freeze the eggs. So it's not the freezing that makes it abnormal. The abnormality that the baby has is because it's an inherent reason for that abnormality to happen.
Okay.
So freezing of sperm should be, there was a time in the facility where I work, a lot of people, military guys around our place, we had to offer some form of free services of sperm freezing for the military men, because they're always going on special assignments. So they should feel free to freeze their sperms and all of that.
So do you think that sperm freezing should be a topic that should be talked about more often?
Yes. Because I guess I feel all couples should know about it, because most times women are tied up, are bottled up in a corner, are pushed to a corner that they are ovulating and their partners are not there, and they stay apart. They have to travel just to go and have intercourse to attempt to get pregnant. If their sperms are frozen somewhere, the gynecologist can prepare her for ovulation, prepare the sperms and deposit the sperms inside.
Wow.
And then that will help, because you don't have to have sex to have babies. Yes. Babies come when sperms and eggs meet, and there are a lot of ways that eggs and sperms can meet. So freezing sperm is good. Freezing everything is good.
Freezing life is good.
Everything.